As a physical therapist, I have said for years, this is the one surgery I don't want to have, a carotid endarterectomy. Now, don't get me wrong, it's a life-saving procedure, but it's also one that I've seen go very, very wrong. And now someone in our family is about to have it. One artery is blocked 90%, the other is completely closed. Now your carotid arteries run on right here on either side of your neck on the front. They carry 80% of the blood to your brain. And when they are narrow, that's when you are at serious risk for stroke. There are also vertebral arteries that run along your spine to the back of the brain. Both of those were blocked for this person as well. If you have coronary artery disease, odds are that your carotids and vertebrals aren't far behind. It's the same disease, different artery. It's not true in every case. For instance, I have 0 in my coronary arteries, but I do have mild plaque in my carotids. So my risk is not a heart attack, but my risk would be more of a stroke. So in my 36 years as a PT, I've treated patients after strokes caused by blocked carotids. And I've treated patients after carotid surgeries that didn't go as planned. Some regained independence, but many never did. Paralysis, speech loss, visual problems. These are not numbers on a chart. These are people whose lives were changed forever. That's why I've always said this is one surgery I never want to need. So a carotid endarterectomy removes plaque from the inside of the artery, literally. They literally open it up and clean it out. It's a brilliant surgery when caught in time. But if you wait until the artery is 90 to 100% blocked, you're rolling the dice. It's more difficult to do. And yet most of these blockages are silent until almost 70% of the artery is blocked. And then you're in the serious zone. That's where accountability comes in. The same kind we talked about yesterday, the Dorothy accountability, that she taught me growing up. She used to say, if you knew and you did nothing about it, you chose it. If you have high blood pressure, diabetes, insulin resistance, or coronary artery disease, you can't wait for the symptoms. You have to ask for the tests. Ask your doctor for a carotid ultrasound. It's painless, quick, and inexpensive. Sometimes the community will just announce that you can come and get a free one. Ask for a coronary artery calcium score if you haven't had one of those. And then if you do a CT angiogram, if you already have vascular disease, because it'll tell you how much soft plaque versus old plaque or calcified. When you're doing this, you're not being pushy, you're being proactive. Most carotid and coronary blockages begin years before they're ever detected. The real cause, insulin resistance, inflammation, high triglycerides, low HDLs, high blood pressure, and oxidative stress. This is where your diet, keto, carnivore, or low carb, matters. Not just for weight loss, but for protecting your brain and your heart and your future independence by protecting your arteries. If you remember one thing from this PT Monday, let it be this. Don't wait for a stroke or a surgery to get serious about your health. Ask the questions, request the tests, be accountable, not when it's too late, but right now. If I'm being honest with you, and this person who has to undergo this surgery had all those things that we just talked about that lead to it. If this hits home for you, share it, because someone you love might be walking around with silent carotid disease and not even know it. And watch my video series on high blood pressure. I'll put it at the end and link it in the description, and insulin resistance. It'll connect every dot to this story. Dr. Rose, I'll see you tomorrow in the next Daily Spoonful.